Alright, so this video is going to cover the axial skeleton, and so we're not going to go into a ton of detail about all of this, so this isn't going to be a too terribly long video, but I do want to kind of touch on some important points here about the axial and then appendicular skeleton in the next video. Alright, so we're going to look briefly at these different learning objectives, so functions of the skeletal system. We're going to talk about the two major subdivisions. I'm briefly going to cover the bones in the skull and vertebral column and stuff, but since a lot of this was covered in lab material already, I don't usually take time to do this again in lecture because we've already learned most of these bones and the features on them, and then we'll end with talking a little bit more about embryonic development of the axial skeleton. Alright, so divisions of the skeletal system. So we're going to go over some different functions and differences between the different parts of the skeletal system. So again, our skeleton as an adult has about 206 bones. We have two major divisions, the axial skeleton and then the appendicular skeleton. The axial skeleton is made up of about 80 bones and is made of the skull, vertebral column, and thoracic cage, which we have already covered two of these. Skull is going to be on the second lab exam, and then the appendicular skeleton is made up of the remaining approximately 126 bones and involves the pectoral girdle, upper limb, pelvis, and lower limb. Alright, so the torso is going to be that axial skeleton, arms and legs, and then the hips and shoulder joints are part of that appendicular skeleton. So this is showing the axial and appendicular skeleton. The appendicular skeleton parts are in this kind of bluish gray color here, slight greenish color depending on your color perception, and then the axial skeleton is shown in more of that kind of tan off-white coloration, just to kind of give you that visual comparison. So the axial skeleton isn't the largest part of our skeletal system, but it is very, very important. It's obviously protecting some really, really essential structures in there. Alright, so we're just going to kind of briefly go over the skull because this will be covered in more detail in lab next week when we start our second unit. So the skull is also sometimes called the cranium. Its job is to support the facial structures and to protect the brain, and so it's divided into the bones of the face or the facial bones, and then the brain case or the cranial bones. Alright? So brain case, cranial bones, this is going to house the brain primarily, and then facial bones are forming that face and helping to support some of those muscles and stuff that we use to move our mouth and eyes and things like that. Alright, so we're not going to go into detail about this right now, but this is a great graphic in your textbook that will probably help you out a lot when we start learning the skull next week, so you might want to refer back to these slides or something like that. But lots of different things going on in our skull. So the facial bones, we have multiple facial bones as you can see here. Some of them are pretty tiny, like this lacrimal bone right here, and then we have some larger ones like the mandible and the maxilla. Side view, we've got more showing from that brain case area, so these are much larger bones than what we see in the face, but they are separate individual bones. This is the back side of the skull, so posterior view, so we've got just some of those cranial bones shown back here. And then looking at superior and inferior views of the base of the skull. Again, I don't want to take too much time to go over all of this since we'll be covering this in lab next week. We can also split the skull with that sagittal cut, and so this is where we see some of these irregular bones that we've already talked about, with these bones that have sinuses in them. So these are openings inside of a bone that are going to house air in them, and so we have some of these sinuses that we'll be learning next week, but these bones are usually considered to be irregular bones because of that feature of having that airspace inside. All right, so we're not going to talk too much about these bones, but temporal bone, pretty irregular shaped. Sphenoid bone, also pretty irregular and is going to have a sinus in it, kind of back in here. The ethmoid bone is a pretty cool little bone. This is another irregular shaped bone. Lots of little air cells in here. And then we've got that nasal cavity, so we'll be learning a couple of these features next week. We're not going to talk too much about the fossa in the cranial bones, but we do have some of these depressions up here in some of these bones housing the brain, just to give us a little bit extra space for that brain to be able to move around a little bit in our day-to-day life. Sutures are types of joints. These are non-movable joints. We'll talk more about these in the articulations videos, though. Here's our maxilla. So this is the upper jaw. So the upper portion of your jaw. Mandible is the lower portion of the jaw and is the only part of your mouth that actually moves. So your maxilla, this upper portion, isn't what's moving, it's just the mandible. Bones of the orbit, this is what's making up the eye socket, so where the eyes are going to be sitting. We've got that nasal septum formed by a couple different bones in here and then filled in with cartilage further out. These are those sinuses that I was talking about, or paranasal sinuses. So we've got some up here between our eyes, some more back here behind the nasal cavity, and then some here on either side of the nose. So this is why if you have a really bad cold or a sinus infection or something, or really bad allergies, that you sometimes get a lot of pressure and pain in this particular area of your face, and that's because that we have these sinuses that are going to get inflamed and angry when we have infections and irritation. The hyoid bone we'll also talk about with the skull, but we're not going to go into a ton of detail about it. You just need to be able to recognize it as the hyoid. So this is another irregular bone. This is not actually attached to any other bones. It's going to be tied into some cartilage with some ligaments and stuff like that. But this bone is really, really important for our ability to swallow and talk. Next up is the vertebral column. So we've already covered a lot of this in lab, so we're not going to go into a lot of detail here. Vertebral column, spinal column, or spine, all interchangeable terms. So these are vertebrae separated by those intervertebral discs made out of cartilage. It's going to support the head, neck, and body and allow for some of the movements, as well as protecting that spinal cord, really important. So this is our vertebral column. We've already learned all of these different regions and features of individual vertebrae, like what's shown here. So we can see those intervertebral discs in here. We can see where those nerves are going to start coming out of the spinal cord in those foramen formed by the two adjoining vertebrae. So that's going to be that intervertebral foramen. Cervical vertebrae, pretty delicate. Again, we have those two special ones, the axis and atlas. Those are the first two that are supporting the head. Thoracic vertebrae have some features for articulating with those ribs again. All right, so that's how that looks. So the head of the rib is going to go to both the superior and inferior costal facets on adjoining vertebrae, and then that tubercle of the rib is going to connect to that transverse facet on these vertebrae. And then lumbar vertebrae, big and bulky because they're supporting a lot of weight, having a lot of pressure on them, so they need to be a little bit stronger and thicker. And then we've got the sacrum and coccyx, which are fused vertebrae, and so that's how we get these foramina, the sacral foramina, because we're fusing those vertebrae. That median sacral crest is made out of the spinous processes of these vertebrae that got fused together. And then the coccyx is very, very small vertebrae that fuse together, forming that last little structure, also sometimes called the tailbone. Here's another view of that intervertebral disc. So these cartilage discs are made up of a couple different structures, the annulus fibrosus, which is this outer layer, and then the nucleus pulposus, which is that central area. So the exact makeup of substances and fibers in each of these regions is a little bit different. And so what can happen with like a herniated disc is usually you're going to start getting breakdown of one of these two areas, and that's going to cause a lot of pressure, and it's going to start pushing all of that tissue out, further out from the vertebrae, so it's not staying kind of within there. It's going to start bulging out. Sometimes they can slide off to one side or the other. So there's a lot of issues that can happen as we get older, or if there's certain injuries that happen. We've also got some really important ligaments that help support the vertebral column, so it's not just bones and muscles. We've got some really important ligaments here connecting that skull, as you can see, down further to some of these vertebrae, and then we've got more ligaments traveling down the rest of the vertebral column. And next up is the thoracic cage. So this is going to be sternum and ribs protecting the heart and lungs. So we've got 12 pairs of ribs with their costal cartilage. These are anchored in the posterior side to the 12 thoracic vertebrae, and then we've got the sternum in front. Again, really important for protection. So again, we've got our sternum here made of the manubrium, body, and xiphoid process, which is cartilage. And then we've got those ribs attaching in to the body of the vertebrae. Clavicle is going to attach to the manubrium, and then those ribs are also going to be attached back to those vertebrae again. So we learned about ribs in lab already. Remember, we've got some different types of ribs. These are going to be attached either directly or indirectly to the sternum using costal cartilage. So we've got those true ribs that attach directly to the sternum through their costal cartilage. And then we have some false ribs that are indirectly attached to the sternum using the cartilage. And then we've got those last couple that are also called floating ribs because they do not attach to the sternum at all, and so they're partially floating. All right, wrapping up with embryonic development of the axial skeleton. So we've already talked about different types of bone development, so we're gonna just look at that again here. So again, the bones that are forming the top and sides of our brain case are made through intramembranous ossification. And as these bones grow in a fetus, they're going to stay separated from each other by these large pieces of connective tissue, very, very dense connective tissue. These are called fontanelles. And so those will slowly fuse together after birth and form those sutures that we saw earlier. And then the facial bones, and then the bones at the floor of the brain case, so right before it starts turning into the vertebral column, those are going to be developed through endochondral ossification rather than intramembranous. And if you remember from a previous video, part of this is because we need these bones to be flexible, and we need the skull to be able to deform so that a baby can be born, and we're not going to get that with endochondral ossification. All right, so those fontanelles are those spaces in between the bones. Sorry, I'm starting to lose my voice, I can tell. So we'll wrap this video up here pretty quickly. But those fontanelles is going to allow these bones to move during the process of birth so that the baby can come out a little bit more easily. Those ossification centers are going to be towards the center of these bones, and they'll keep growing out until that connective tissue disappears and we just have these bones fused together later on in life. All right. For the other parts of the axial skeleton, vertebrae are going to develop through endochondral ossification, as are the ribs and sternum. And that wraps up the axial skeleton.